Catherine. My name is Melody. I'll be your therapist for today. Okay, so I'm just gonna be explaining to Catherine here what my plan, the goals of a treatment plan is. Okay, so my plans are I'm going to increase your range of motion. I'm also gonna increase your circulation. I'm also gonna decrease the pain that she came here for. So she came for with a shoulder pain. Okay, so what type of massage therapy I'm going to be using is I'm going to be using some gentle Swedish massage with you. I'm also going to be using some joint play to increase your range of motion. I'm also going to be using some effleurage and pet massage to be able to work on that circulation and that around that shoulder. And also to decrease the pain, I'm going to be using some technique to be able to decrease that pain. Okay? So at the end of this treatment, I'm going to be sending you some program for your remedial exercises that you could be using for to complement the treatment with your recovery. Okay, this will be a home care exercises. Okay, and also through the treatment, I'm going to be using some hydrotherapy with you. I'll be using some cool and warm compress. Although it could be to the extreme of hot or cool. If is that the case, I'm going to be putting some extra towels to make sure that you're comfortable. Okay? Okay, so the benefit of this treatment for today is that you're gonna be able to have some increase of your circulation around that area. You're gonna have some decreased pain. You're also gonna have some increased range of motion here, right? So, but the risk of you having this treatment, you might feel some lightheadedness after the treatment. You might also feel some achiness because I'm going to be working on around this area here. I'm going to be using some techniques, and that way you might feel some achiness after. Okay? But I don't really see any complications or any cautious thing that's preventing me from doing this treatment. So I want you to know that, you know, the anticipated response that you will be having, that whatever pain that you came here for, that will be either diminished or it'll be completely gone, you know, whichever is that shoulder pain that Catherine is experiencing, okay? So again, I have mentioned the area in the shoulder, the right shoulder, but also I'm going to be working on the compensatory area on the left side of the arm, okay? So I'm also going to be working on the chest area here, and also along the arm, and also at the back. Posterior, this is the anterior, and then the back is the posterior. I'm also going to be working on her area here. Okay, and also with the draping, what's going to happen is, Catherine, while you're on the table, I would be covering you with the exception of your head. Okay, if the instance that if there's any occurrence that you feel hot, I can let you have your both arms out, but this is a guarantee that we're only going to be undraping the area that we're working on. For instance, if you're going to be working on your right shoulder, everything is covered except the head and then the right shoulder. Okay, Catherine? Okay, so I just want to check that, you know, there's no really consequences in this treatment, but I can guarantee you that massage therapy can, you know, speed the process of healing, right? So it's in the matter of that you're not comfortable with this treatment that I have for you. I have a plan of treatment for you. I could send you some program that could, you know, help you with your recovery. Or if you're not comfortable with the skin-to-skin contact, I could also do a treatment with you over your clothing. Okay, so I just want to make sure that me as a therapist and you being the client, I'm going to be checking on your comfort level always, and your security level is our main concern here. Okay, and with regards to pain, I have to explain to you, Catherine, that after some treatment, you're going to be experiencing some achiness, slight, you know, achiness, some discomfort, and that is normal because it is part of the treatment. Okay, and I just want to make sure that there's any you know, alternatives that I can do for you. I will be doing that. Okay, so with you guys, I'll be explaining the fees, right? So for me, Catherine, I'll be charging you $120 an hour. That consists of 40 minutes of treatment time on the table. 15-minute assessment and 5 minutes of the remedial exercises. I will be prescribing them to you, meaning I'm going to be showing them to you, and I would like for you to do this at home. Okay? So all this exercise I'll be doing at the end of the treatment. Okay? And after that, I'll be reassessing you. But for the meantime, I would like to see you twice a week in the next 4 weeks. Okay? And then we can reassess then. Okay, so Catherine, do you have any sensitivity to any lotion or water?
No.
Or any form? No?
No.
Okay, that's good. Okay, so Catherine, I just want to let you know that at any time during the treatment, you are not comfortable, you have the right to stop it, you have the right to modify it. Please let me know if the pain gets too intense, okay? Because I can reduce the pain scale from 7, I could reduce it to 5, okay? So either I could use a different techniques, okay? Just communicate with me and let me know during the treatment, okay? Do you have any questions so far, Catherine?
No.
No? Okay, do you have any questions for me?
No.
No? Okay, so Catherine, do I have your consent?
Yes.
Okay, so I would like for you to sign on a consent form, okay? And also, Catherine, I would like for you, so I'm going to wash my hands. That will leave you time to get on the table, okay? And I would like for you to take everything up, right? Because I would like to work on this area here, okay? I would like for you to lie on your back, facing up, and I would like for you to be in between the sheets, okay? If you do need assistance, please let me know, okay?
Okay.
So when I come in, I'm going to be knocking on your door, making sure that you're ready before I come in, okay? Okay, so Catherine, also just because that we are going to be working on some sensitive area here, I'm going to be including another form for you to sign before I start the treatment. It's called a sensitive area form, whereas it will indicate that the purpose of the reason why I have to work on your chest area, okay? The purpose of that is I need to work on some hypertonicity in this area that's probably a predisposing factor why your shoulder pain or there's some discomfort in your shoulder. I'm also going to be working on this area, and I want to make sure that the consent is voluntary. You can withdraw at anytime and anytime you want, okay? Okay, so Catherine, do you have any question? No? Okay, so now I'm gonna go ahead and I'll be knocking when I come back, okay? Thank you so much.